Okay, well, welcome to everybody. I see that the recording has now started, so I think what we'll do is 2:30. So I'll hand over to Greta Massetti, who will run this webinar, and welcome to everybody.
Hello, everyone. Thank you for joining us. We're so excited to have you all, and welcome to this webinar today. The title of today's webinar is focused on income and economic strengthening, which is one of the key strategies in Inspire, 7 strategies for ending violence against children. And we're going to hear from 2 experts today about implementation and evidence for programs in this income and economic strengthening strategy. So we're really excited to hear from them. To those of you who have joined and are putting your names and your where you are located in the chat box, thank you for doing that. It is always welcome to know where people are joining from. If you haven't done that yet, please go ahead and do that now. I'm Greta Massetti, and I'm the moderator for today. And so in terms of the webinar today, this is this is one in a series of webinars on Inspire. The objectives of the webinar series are to introduce Inspire and emphasize the needs for its implementation and scale up in countries around the world, and to provide detailed insights into each of the 7 strategies and the cross-cutting elements. The webinars each intend to do a deep dive into each strategy and think about and discuss opportunities to do implementation and to know what the evidence behind a lot of these programs are. We are really speaking to a broad audience. We hope some of you are policymakers and legislators, planners, practitioners, leaders in faith-based and traditional communities, funders, advocates, civil society organizations. And if you are someone who doesn't fit into any of those categories, we welcome you as well. As far as topics in the series, we are right now in the, I believe this is the 6th webinar on economic strengthening. We have 2 more coming up in the next month. One will be focused on response and support services, and the last on education and life skills. And if you have not had a chance to review the other webinars, there's a link in the slide, and we will put it in the chat box as well, so that you can go to that site and go back to any of the webinars that have already been hosted, and you will be have an opportunity to review those slides, those webinars. Today, I'm here to welcome and introduce the series. Then in terms of our agenda, I will turn it over to my colleague, Mark Canavera, who is co-director of Care and Protection of Children Learning Network at Columbia University. He's going to give us an introduction on the income and economic strengthening strategy and talk about relevant findings from the Global Status Report on preventing violence against children. And then we are going to have 2 presentations from experts in this strategy. One is Shalini Roy from International Food Policy Research Institute on cash transfers and impacts of gender-based violence, and Tia Palermo from University of Buffalo on social protection and violence against children. Our 2 speakers today have worked together very closely in doing a joint presentation. So we're going to hold the questions until the end, and that way we can kind of combine the question and answer session and engage them in a dialogue. If you have questions, please put them in the chat box, not in the Q&A section. I will be monitoring the chat box and noting the questions, and will moderate the questions at the end. All of the questions will be done by chat box. We will not open up the microphones to the attendees. So to that end, I'm going to, I only was able to do brief introductions for our speakers so that we can have the most time to hear from them. And when they begin speaking, I will add their biographies to the chat box so you can see who we're talking to. So I'm excited to turn it over to my colleague, Mark, and have him take it from here.
Thank you, Greta. And I too am excited to hear from Shalini and Tia. So I'm going to try to make this introductory presentation quite brief. I hope that you all can see this now. This really is a presentation about how income and economic strengthening initiatives fit into efforts to prevent and reduce violence against children, which is an outcome that occurs because families' economic security and their stability have been strengthened through these economic initiatives, therefore reducing child maltreatment and reducing intimate partner violence. There are a number of mechanisms by which this can happen. Cash transfers, which are direct payments. There are also, large bodies of learning around savings and loan groups and microfinance, which I imagine most of you on the webinar today have heard about. Just as a note, we really won't be delving into those bodies of literature today, but if you are interested in them, the Inspire Technical Package has more information. We will be focusing on the first bullet point here, cash transfers, which is where a lot of the more recent evidence, much of which is quite robust, is coming from. But income and economic strengthening does include other approaches to helping families to become more economically solid. Micro enterprise, so small business, vocational training, growing markets, creating jobs, etc. But we really will be focusing on the cash transfers today. How is income and economic strengthening linked to preventing violence against children? It's what I would like to start with making the following points is that violence against children does occur across all economic classes, and it's important not to forget that, and that the concern about violence against children is not class specific, but poverty is a risk factor. And so poverty is associated with either unresponsive and neglectful parenting or harsh parenting that includes emotional and physical violence. Poverty does, we now have strong research to show, increase the likelihood of family separation, which is, of course, a huge risk factor for children to be subject to various forms of violence. Poverty is associated with children dropping out of school, which we know from the education and life skills strategy of Inspire is a protective factor and makes children more likely to, children in poor families are more likely to get married early. And poor environments and neighborhoods are often unsafe. This is, of course, linked to their political status in a given place. But all of these are factors we need to consider without neglecting that violence against children occurs across economic strata. So a few of the features to bear in mind. These are components of income and economic strengthening interventions to bear in mind when designing them. It's often helpful, and we'll hear a lot about this today, to combine income and economic strengthening interventions with interventions that focus on the social element, parent support programs, life skills, normative change, especially gender normative change approaches. These all work very well together, and that is a body of evidence that is just growing exponentially by the day, and I think a very exciting indicator where we should be heading in terms of making our violence against children reduction programs more robust. It's also important to remember that households simply need an adequate economic base to be able to ensure children's well-being. So really the idea is that having that solid economic base is just a sine qua non, to use the Latin. You cannot have the child well-being without it. When you are designing your income and economic strengthening interventions, regardless of the sector you are coming from, it's helpful to include staff with economic and business skills backgrounds, not simply the social welfare or the child and family welfare backgrounds. This is often a different set of vocabularies and skills and ways of approaching work. And I think there can be a lot of fruitful cross-pollination when staff members from different backgrounds like this are able to come together and co-design programs. These income and economic strengthening initiatives also should not simply be standalone one-time interventions, but should be connected to the broader social services, social protection schemes and systems. These strategies can be combined with all other Inspire strategies. We often wonder, how do we connect this strategy to the others? With something like income and economic strengthening, it connects to all of the other 6 strategies. So on the implementation and enforcement of laws, I just want to point out that, social protection schemes that are often, rooted in country policies are often centered around income and economic strengthening. In terms of the policies that we know work to prevent child maltreatment, the laws around access to alcohol and the misuse of alcohol can also be bolstered by income and economic strengthening initiatives that offer, for example, alcohol vendors to have alternative ways of earning income. The norms and values we've already referred to being a kind of critical addition to pure income and economic strengthening initiatives. So all of the efforts to redress gender inequities and promote gender equality are very natural and important complements to income and economic strengthening initiatives. Safe environments is an important, it's probably our least studied Inspire strategy, but making sure that communities have healthy economic alternatives, ways to avoid illegal or risky sources of income generation are a really important feature that we need to be learning more about. We have also referred, I'll kind of lump together the parenting caregiver support and the education and life skills, just because we know that, these, as with the gender norms and values, are important complements to income and economic strengthening initiatives. In terms of response and support, supporting foster and kinship care families for children who have been separated from their families can be an important component. And in terms of response services for survivors of violence, economic strength can really be a core component of their ability to heal and to move forward in life, even for children. So I think it's an important element not to overlook. Finally, in terms of just the broad health, social, economic agendas, our very last point there, this is the kind of global atmosphere we are existing in. Income and economic strengthening contributes to poverty reduction. Hopefully, in a world of growing inequity, we can use income and economic strengthening to begin to reduce global inequities, to promote social, economic, and political inclusion, and of course, excellent outcomes for child health and nutrition as well. Just a few minutes. I hope I haven't gone too long on the global status report. This is a relatively new report from the World Health Organization and a number of its partners to really document what countries are doing to prevent violence against children, mapping their efforts against the Inspire strategies through consultations with over 1,000 decision makers at country level in a really large number of countries, 155. There is a link there to the report that you will have when you have access to these slides after the webinar, and a new video that has been produced in English, French, and Spanish that I would encourage everyone to watch. But looking at income and economic strengthening, less than a third of countries who participated in the global status report were including sufficient income and economic strengthening approaches. So it's a really neglected area of violence prevention for children. And I would add, there is a note at the bottom here that the European region seems to be doing fairly well because social protection schemes include a cash benefits component. So that is the one big blue bar we see sticking out there where there seems to be some progress that is hopeful. But in general, a picture of a lot of work to do. And we will hear how to do that from our other speakers. I'll turn it back to you, Greta.
Thank you so much for that overview, Mark. I will now go to Shalini Roy, who's going to be our first presenter on the actual program. So over to you.
Hello, everyone. Thank you so much for the wonderful introduction and for once again for inviting us to join today. It's a delight to be part of this series and so great to see so many people joining from all over the world. I'm just going to try to get my screen shared. Is this showing up for you?
It is, yes.
Wonderful. Okay, so I will jump right in. As you heard from Mark, we're going to be focusing today speaking about how cash transfers can be used as a strategy to prevent violence against women and children in low and middle income countries. And as part of our presentation, we'll actually discuss a bit why you might want to bring those together. This is going to be a joint presentation by Tia Palermo and myself. We'll switch about halfway through and we look forward to your comments and questions. So echoing what Mark described, just to situate what we are doing within the overall strategy, there's of course several approaches within the income and economic strengthening strategy of Inspire. This includes cash transfers, but also group savings and loans combined with gender equity training and microfinance combined with gender norm training. We are going to focus on the cash transfers. And this is largely because this is where the most available rigorous evidence comes from of having meaningful effects on violence. The other approaches are also quite interesting. Tia and other colleagues have actually done a review looking at the relationship. It's less conclusive, but we're happy to talk more in Q&A. So what we will discuss today is first just framing the issue and motivating it. We'll start with how the global coverage of cash transfers do make them such a promising platform for violence prevention at scale. And this touches on what Mark described. The bulk of our presentation will focus on the evidence. So looking at what the evidence shows about cash and violence prevention as a whole. First, as I alluded to, we'll try to give a sense of why look at violence against women and violence against children together. Then we'll move to the evidence of how cash affects these. So starting with cash transfers and violence against women with a particular focus on intimate partner violence. And then we'll switch to Tia will speak on the relationship between social safety nets, particularly cash transfers and violence against children. And we will close with some recommendations on programming for what's implied by these findings. So in terms of the coverage of cash transfers, one of the kind of primary appeals of using cash transfers or studying cash transfers and their role for violence prevention is that they operate at large scale and they have potential and promise for continuing to be scaled up. So as of 2018, cash transfers were a substantial and growing share of social safety nets globally, including in low and middle income countries. Just to fix terms, over on the right, you can see that under the umbrella of social protection programs, there's many types of programs, including labor market policies, insurance schemes. One type is social safety nets. Within those, one type is economic transfers. Within economic transfers, one type is cash transfers. But these, as of 2018, reached about 11% of the population in low and middle income countries, which is quite substantial, particularly when you consider that these tend to be poor populations within these countries, and so quite vulnerable and among those whom you would hope to reach. There's also, robust interest from stakeholders, even those who may not have violence necessarily on their agenda. because cash transfers have been shown now to have really broad impacts and be quite cost effective for reducing what you might think of as kind of core objectives of poverty, food insecurity, improving human capital, and so on. So overall, the scale of these types of programs makes it important to understand how they affect violence, and also makes them a promising opportunity to leverage violence prevention if we're able to understand what makes them work better for violence prevention. And just to note here that in the past year with the COVID-19 pandemic, social protection measures have dramatically increased around the globe. That includes low and middle income countries. About a third of these social protection measures have been cash transfers. At the same time, as you all know, there have been growing concerns about violence against women and violence against children. So this kind of adds to the motivation for understanding how cash can affect violence. If, for example, in these types of crisis situations, cash is often used and violence is often increasing. So turning now to the evidence, we start with why look at violence against women and violence against children together in this presentation, but also more generally in terms of strategy. And a main factor is that there's a really strong overlap in the risk factors that underlie them. In fact, these often occur, violence against women and violence against children often occur in the same household. And so it is quite compelling to look for strategies that are able to address both. And one of these risk factors is in fact economic insecurity, which gives a natural opening for how cash transfers might play a role. Another factor is that each increases the risk of the other. So experiencing violence in childhood, witnessing violence against women in childhood are both risk factors for in the future perpetrating violence against children, perpetrating violence against women, experiencing violence against women. So the occurrence of each is a risk factor for the other occurring. They also have common consequences across the lifespan, including mental health and other adverse consequences, and these are compounded by each other. All of which together provide a motivation for really consolidating the efforts to address the risk factors that are shared across them to help prevent both forms of violence and halt these intergenerational effects. So moving now to looking at the relationship that we see between cash and different types of violence, we'll start with violence against women, and then, as I mentioned, turn it over to Tia to speak about violence against children. So we'll start by focusing on a review that was done in 2018 by some colleagues of Tia's and mine in the Cash and IPV Research Collaborative. And this focuses really on the relationship between cash transfers and intimate partner violence. Again, because that's where the relationship is the strongest, both in the evidence, but also kind of conceptually. So this has been a quite influential review. It was profiled in The Economist just this past week. It was a review of 22 quantitative and qualitative rigorous studies looking at the relationship between cash and IPV. And in this review, more than 70% of the studies showed the cash transfer programs decrease IPV. The rest of the studies largely showed no significant impacts. Notably, there was no evidence of average increases in IPV. There's often concerns that cash transfer programs, particularly if they target women, might increase violence. A lot of the cash transfer programs that are reviewed do target women. So it is notable that there's no evidence of increases on average. Just to note that there was a more recent meta-analysis of just the quantitative studies on cash and IPV, many of which overlap this 2018 review, and this confirms that cash transfer programs lead to average decreases in IPV. Just to give you a bit more of the detail of what's in the Buehler et al. Review, it's worth noting that none of the cash transfer programs that were studied in the review explicitly target violence reduction or IPV as an objective. So these are really focused on outcomes like reducing poverty, reducing food insecurity, increasing human capital accumulation, and yet we do see these effects. And we'll talk in just a moment about why we still see these effects. As I noted, the large majority of these studies are showing decreases. or no effect. There's a small number of studies that show mixed results, which is basically an increase in one type of violence and a decrease in the other. So this typically was a decrease in physical or sexual violence and an increase in emotional. It's 2 studies out of the 22. The impacts where we see decreases are quite substantial, up to like 66% reductions in IPV outcomes, and they're more consistently showing up in physical and sexual violence. So if these cash transfer programs are not targeting IPV, why are they having an effect on IPV? So the review looks at the evidence and finds support for 3 main pathways. And I'll go through these very quickly, but just to give you a sense of how this is working. So the first is economic security and emotional well-being. The second is changes in inter-household conflict. And the third is changes in women's empowerment. So I'll go through these each in turn very quickly again. The first pathway, the economic security and emotional well-being, is really this idea of, kind of the pure effect of increased income in the household, increasing economic security, and that leading to improved emotional well-being for everybody in the household. And in particular, decreasing poverty-related stress, possibly associated use of alcohol, both of which are risk factors for IPV. So it's really this idea that having less economic insecurity in the household improves emotional well-being, which reduces IPV. And you can see a quote here coming from a program in Ecuador. In my household, it was like happiness. We all got along with my children, with my husband, in my house, we were happy because before we did not have enough money for those things. And this theme comes out in a lot of the cash and IPV literature that does try to look at mechanisms. I'm sorry, just to mention that the first mechanism can play out regardless of who's getting the cash transfer in the household. It's basically happening at the household level, that there's more resources. The second is changes in intra-household conflict. And this is related to the previous, but the idea that when there's more cash in the household, there's just more available to meet daily needs. There's a theme in quite a bit of the qualitative work that, as you can see in this quote, that, women ask their husbands for money to buy food. There is no money there, a fight starts, that fight escalates into violence. And simply having more cash available to meet those daily needs reduces the conflict in the relationship, which reduces IPV. In theory, there's a possibility that the increased availability of cash could increase conflict in the relationship. In the evidence, we see very little of this happening in practice. So it seems that the cash is able to reduce conflict in the relationship due to increasing the availability to meet daily needs. And in this quote, you see, at the end, she says, we had many fights because of poverty, not only for us, for all poor, fights come from suffering. And that's from Turkey. And then the last is related to women's empowerment. And this you might especially expect if the transfers stay somewhat in the control of the woman. And this is the idea that if the transfers are able to increase women's empowerment, this might shift her power within the relationship to allow her to better assert that she won't accept violence in the relationship. So, if her partner is accommodating of that, accepting of that, you would see a decrease in violence. Again, has been some fears that her partner might feel threatened by her increased empowerment, and that might lead to backlash, which could increase violence. In practice, in the evidence, we see thus far very little of that. But you can see in this quote from Northern Uganda, a woman describing that, now that I have my money, I can have a say on how to spend income. So with the evidence in Buehler et al. And the evidence on, kind of building the plausibility for how cash can affect intimate partner violence, we have quite a solid base of evidence now that cash can reduce intimate partner violence. There is kind of this new generation of evidence continuing to come out, which is looking more at different nuances of how this relationship plays out. So I just wanted to quickly give you a few examples of what kinds of questions the new evidence is looking at with some case studies. So one type of question that's being looked at in a lot of the new studies is sort of how, so we understand that cash transfers can decrease IPV. How do these impacts depend on kind of the specifics of the design of the program? And how does it depend on the types of households that you're intervening with or that you're providing benefits to? So just to give you a very quick idea of this, I'll describe two examples of similar programs, both in West Africa, where the studies both disaggregated the impacts by whether the household was polygamous, or the couple was polygamous or not. And the two programs have a different target recipient. So just to give you a sense of how program design and household characteristics can matter. So those two case studies will be Ghana, the Livelihood Empowerment Against Poverty 1000 program, or LEAP 1000, and Mali, the Jigisemejiri program. And then the second question I'll give as an example is looking at sustainability of impacts. So we understand that when the cash transfers are provided, they can often reduce IPV, but what happens after they end? And that was something that was looked at in a study in Bangladesh, the Transfer Modality Research Initiative, or TMRI program. So for Ghana and Mali, again, the point here will just be to give you some broad brushstrokes to try to understand how design and initial characteristics can matter rather than trying to get into the details of each of these case studies. These were both government-led unconditional cash transfer programs. Ghana provided cash transfers every 2 months and provided a health insurance premium waiver. Mali provided cash every 3 months with light trainings that were referred to as accompanying measures. In Ghana, women were targeted, women who were pregnant or had a child under a year old. In Mali, this is one difference, household heads were targeted who were usually male. In both the studies, polygamy was looked at as kind of a determining factor, or, the impacts were disaggregated by whether the household had a polygamous marriage at its center, and about a third of the sample in each study was polygamous. So here, I'm just going to give you kind of some takeaway points and then refer you to the details in the case studies rather than going through all the details. But what we see from comparing Ghana and Mali, we see that impacts can differ by initial household characteristics, but how exactly may depend on the program design. So in both Ghana and Mali, we see in terms of impacts that if you look at the full sample, you see either no significant reduction in IPV or relatively small reductions in some dimension of IPV. But in Ghana, if you focus on the monogamous sample only, you see much stronger reductions in IPV experience. In Mali as well, if you focus on a particular part of the sample, but there it's the polygamous sample, you see a much stronger and larger decrease in IPV experience. So the reductions are showing up in particular parts of the particular types of households, and that's actually different. We think different types of households. We think that might be because of the design being different. In terms of pathways, in both, you see increases in economic security and emotional well-being. In both, you see reductions in intra-household conflict. Only in Ghana, we see evidence of increases in women's empowerment. This is the program that targeted women. This seems to be coming about primarily through women controlling resources more, which helps in reducing conflict. But the qualitative work notes that this may not necessarily be gender transformative in the sense that norms around gender roles may not be kind of changing themselves. In Mali, we don't see any impact on women's empowerment. This was the program where men were targeted. In fact, there's even some suggestion that male authority might be increasing given that they're the ones who are targeted. And this kind of leads to the other point that's in the bullet at the bottom, that their impacts of a program are only going to be sustained if the impacts on the pathways are sustained after the program ends. It's kind of obvious, but when you think about how to have sustained effects, you need to think about the pathways. So the qualitative work in each of these studies kind of made the point that in each of these, the cash transfer program was reducing violence, but beyond the program in Ghana, if, gender roles continued to be a point of strain and stress, beyond once the economic security and inter-household conflict, if those issues did not continue beyond the end of the program, things might revert. Same in Mali. If emotional well-being impacts weren't sustained after the program ended, IPV might revert. And this was something that leads into our other case study in Bangladesh, where we explicitly looked quantitatively at what happens to IPV after cash transfers end. So here we're looking at the Transfer Modality Research Initiative program, which was a pilot program that provided cash transfers or food transfers, but I won't describe that in this presentation, either with or without an intensive group-based nutrition training. So that's a picture of the nutrition training on the right. These were basically every week for 2 years, women in the village gathering together to discuss nutrition. It wasn't about gender or violence. It was focused on infant and young child feeding. This was implemented by the World Food Program from 2012 to 2014, and it followed a randomized controlled trial design. It targeted mothers of young children under 2 in very poor rural households. And particularly at the time, rural Bangladesh was quite a patriarchal setting where female seclusion norms were prevalent, which is the idea that women tend not to leave the home, particularly without male accompaniment. Men are the ones who go to markets. And so relevant to this study, absent this kind of group training, women tended not to have much social interaction. These group trainings, in fact, led to women having somewhere that they could meet other women once a week for 2 years. So in terms of our results, what do we find? So during the program, we find suggestive evidence that all of the treatment arms did reduce IPV, consistent with the prior evidence in the Bueller review. While the cash is going on, cash alone or cash with the training all reduce IPV. What we see when we went back 4 years after the program ended is that women that had received cash now looked no different from women that had never received anything. But women that received cash with training were now experiencing an 11 percentage point reduction in physical IPV relative to those who had never received anything. So this suggests that during the program, receiving cash did reduce violence, but after the program ended, in order to sustain these effects, even 4 years after, the addition of the training really made a difference. And in terms of why we think that's happening, we hypothesized that the sustainability of this additional training arm is driven by increases in women's social capital. And again, given the context for women had very limited social interaction, this might have actually sustained beyond the end of the program. And without getting into all the detail of how we think this plays out, I'll just mention that the increase in social capital was likely to increase women's empowerment, perhaps in a sustained way. Increasing her control over economic resources, giving her greater psychological well-being, and increasing her social capital. So to give you some takeaway messages on cash and IPV before we turn towards cash and violence against children, we think that the evidence is now quite strong that cash transfers are proven structural interventions to reduce IPV at scale and across settings. And this is even when IPV prevention is not an explicit objective. We see that there can be just these effects through the increase in income, leading to improvements in emotional well-being. That said, if we do want to strengthen the women's empowerment pathway, it seems important to consider design features that will allow women to retain control of the transfer. So through messaging, through changing the frequency or size of the transfer, through deciding who should be the recipient of the transfer, and any other measures that can be taken to promote small changes in gender roles within the household that will have the buy-in of men. In terms of sustainability of impacts beyond the end of the program, this is going to necessarily require impacts on the pathways to sustain beyond the end of the program. And we want to note that this can require complementary activities. Which type of complementary activity is relevant, however, is likely to depend on the context. So in Bangladesh, the nutrition training seemed to have been so powerful because in that context, women were quite socially isolated, and these were kind of creating opportunities for social interaction. In another setting, that may not be as potent, but there might be other dimensions of, say, women's empowerment that the complementary activity could address. And all of this, to transition to the next point, all of this has implications for future reductions in perpetration and experiences and violence via the reduced exposure in childhood. And so with that, I'll turn it to Tia.
Thank you. Turning now to social safety nets and violence against children. Next slide, please. We did a review in 2017 where we examined the impacts of social safety nets and violence against children. These social safety nets that we included were non-contributory social protection programs, including conditional cash transfers, unconditional cash transfers, public works where people receive cash payments for work, and also vouchers and fee waivers. Now, there are some challenges to studying the impacts of these safety net programs on violence against children. First, because fewer studies have actually investigated the impacts of these economic strengthening programs on violence against children. And also, the types of violence that children experience vary across their lifespan. There are also ethical issues when we conduct violence against children research, as you know, because a lot of countries have laws where you have to report if you are notified that a child is experiencing severe violence, and also because a lot of times in these impact evaluations and household surveys, we are often interviewing the perpetrator of the violence against children. In addition, the mechanisms are a bit more complex, linking economic strengthening such as cash transfers to reductions in violence against children. Children experience violence in different contexts, such as the home, but also school and labor settings, and they're also experiencing violence from a range of different perpetrators. These can include family members in the household, authorities such as teachers and other authorities, as well as strangers. Next slide, please. When we think about this in terms of the conceptual framework linking cash transfers and other economic strengthening interventions to reductions in violence against children, we can think about the pathways being at the household level, the caregiver level, and also at the child or adolescent level. So at the household, these programs improve the economic security of the household. This can in turn change intra-household power dynamics, as Shalini described. And it can also reduce acute and chronic stress. So as households are less likely to struggle with food security and other economic insecurities, this reduces overall stress levels, which can reduce violence perpetration. There can also be changes to labor force participation and in turn time use. So for example, with a lot of cash transfer programs, we see that household members are then, as a result of the cash transfer, less likely to engage in casual labor outside the household and more likely to engage in productive agriculture for the household, raising livestock, etc. In turn, these can affect well-being indicators at the caregiver level. So they can affect or reduce substance misuse, they can improve psychosocial well-being, and they can improve positive caregiving behaviors. The changes in time use and labor force participation that I mentioned can also result in changes at the caregiver level of supervision time with the children. And as mentioned, it can reduce inter-household conflict. Then at the child or adolescent level, cash transfers have overwhelmingly been found to increase school attendance. So this changes the amount of time that children spend in school, and there could be ambiguous effects on violence risk from that time spent in school. At the same time, these programs have been shown, particularly for adolescents, to reduce depressive symptoms. So it's improving their psychosocial well-being. And these can also reduce problem behaviors such as externalizing and internalizing behaviors. And it can affect the amount of time they spent in high-risk settings such as dangerous work settings. And there's increasing evidence that cash transfers lead to reductions in child marriage, which is itself a risk factor for violence. So all of these in turn can reduce the risk of sexual, physical, and emotional violence described on the right-hand side of the screen. Next slide, please. In 2017, we published a review where we analyzed the social safety net effects on violence against children. We looked at 57 indicators of violence across 11 studies. And what we found is that 19% of these indicators were statistically significant reductions in violence. So we found that these social safety net programs reduced violence against children, and there were no instances of adverse effects where violence increased. If you look at the donut-shaped diagram on the left-hand side of the screen, what this indicates is the larger categories means more studies examined this indicator. And the percentage indicates the percent of all of the indicators studied that were statistically significant reductions in violence. So for example, only one study examined dating violence, that's the dark navy blue, but that study did find protective effects of a cash transfer program on the experience of dating violence among adolescent girls. There's a lot stronger evidence for reductions in violent discipline, the orange on the right-hand side, where 10% of the indicators found reductions in this violence. And also there is more evidence for reductions in sexual exploitation and sexual abuse as a result of social safety net programs. There was not any evidence for reductions in peer bullying, homicide, or other forms of physical violence against children. It's important to note that there are some differences between regions of these studies and indicators. So for example, there were a lot more studies which examined sexual abuse and exploitation in the context of sub-Saharan Africa, particularly in Eastern and Southern Africa, where there's high HIV prevalence. So a lot of the anti-poverty programs are designed with HIV in mind. These often target labor-constrained or households with orphans and vulnerable children, and oftentimes they're aiming to reduce risks related to HIV. But the majority of them, again, are still targeting poverty. So we see a lot more studies on sexual abuse and exploitation in sub-Saharan Africa. And in contrast, in Latin America and the Caribbean, we tend to see a lot more studies which examine violent discipline among young children. And this is largely because the conditional cash transfer programs, which are most prevalent in Latin America and the Caribbean, tend to focus on early childhood development. And that's why they would be more focused on looking at violent discipline outcomes in that region. Next slide, please. Since we published that review in 2017, there have been more studies which have come out looking at the effects of cash transfers and related programming on violence against children. There have been new studies in Bangladesh, Haiti, Mali, Tanzania, and Zimbabwe. So 2 studies which examine impacts of cash transfers on intimate partner violence also investigated the impacts of these same programs on violence against children. And these were the 2 programs from Mali and Bangladesh, which Shalini already described earlier in the presentation. In addition, there's new evidence on Cash Plus and graduation models, which integrate cash transfers with other either complementary programming or linkages to existing services. Some examples come from a pilot targeted to adolescents within the Tanzanian government's cash transfer program called the Productive Social Safety Net, as well as an NGO-run program, Chemin La Vie Meilleure, in Haiti, and Zimbabwe's government harmonized social cash transfer program. Next slide, please. In the first study in Mali, the study authors found very similar patterns for reductions in violence against children as they did for intimate partner violence. So for example, they found no impacts in monogamous households. However, in polygamous households, they did find that the cash transfers led to a reduction in violence against children. There was an 11 percentage point reduction in any physical aggression toward the child in the past month, a 17 percentage point reduction in any physical punishment of the child, and a 23% reduction in the number of psychological and physical violent acts against the child in the past month. Next slide, please. The study from Bangladesh also found similar patterns as what was found for intimate partner violence. So 6 months after the program ended, The transfers plus training led to significant reductions in violence against children. Children in households that received the transfer and training were 12 percentage points less likely to experience harsh physical punishment in the past week. And there was an 8 percentage point reduction resulting from transfers and training on whether the parent reported hitting the child back when the child hits the parents. There were no significant impacts post-program among the households that only received the transfer without the training. Next slide, please. In Tanzania, there was a government-implemented pilot supported with technical support by UNICEF, which targeted adolescents in households that were receiving the government cash transfer program, which currently reaches 1 million households nationwide. So this program targeted adolescents living in those households and provided them with 12 weeks of face-to-face training on livelihoods and sexual and reproductive health. It also provided them with a productive grant, mentoring and coaching, and referral to health services. At the same time, these health services were strengthened to make them more adolescent friendly in the areas which were receiving this pilot. Compared to households that only received the cash transfer program, adolescents in the cash plus households, among the females were 5.3 percentage points less likely to experience sexual violence, and males in the cash plus households were 6.3 percentage points less likely to perpetrate physical violence. So this cash plus program in Tanzania led to a reduction in the experience of sexual violence among females and a reduction in perpetration of physical violence among males. Next slide, please. There have also been 2 new studies from Zimbabwe and Haiti. So Zimbabwe's Harmonized Social Cash Transfer Program is a government cash transfer targeted to food poor and labor constrained households. It combines the cash transfers with complementary services. So for example, some of these complementary services include NGOs being made available at the payment points to provide information about child protection. And some of the information sessions were related to violence against children and where to seek care. This program led to a 19 percentage point reduction in physical violence experience among youth. In addition, in Haiti, an NGO implemented program was an adaptation of the BRAC graduation model, and it was targeted to women. The program was comprised of cash transfers, asset transfer, training, access to savings and credit, and this program led to an 11.9 percentage point reduction in harsh corporal punishment of children. Next slide, please. So in summary, these social safety net programs show promising evidence of reductions in violence against children. In particular, there are promising results related to the protection from sexual exploitation and abuse among adolescent girls. And there's also newer evidence which suggests that cash transfers lead to reductions in violent discipline around different regions of the world. There are still many evidence gaps. So for example, as I mentioned earlier, there are differences by region in what types of violence is studied, as well as the types of programs which are implemented. There's also a lack of evidence on some other violence indicators, such as violence in different settings, such as schools and workplace, whether or not children experience a reduction in the witnessing of intimate partner violence, which we know can have longer term implications in terms of the risk of experiencing or perpetrating intimate partner violence in the future. And finally, there's very little evidence about the frequency or severity of violence which is experienced. We also know that the mechanisms are diverse, and these can include improvements along the pathways such as school attendance, reductions in caregiver stress, adolescent risk behaviors, exposure to high-risk environments, and girls' empowerments. And finally, there's been a lack of many studies which have been able to test the different components. So in terms of cash plus interventions, we have the cash and we have the complementary services referred to as the plus, but very few studies have been able to tease apart the effects of the cash versus the plus or the synergies of receiving both of them together. Next slide, please. So in conclusion, this broad base of evidence makes us think that there's potentially an opportunity to broaden our thinking about how to create safe, nurturing environments in the home for children. There's overwhelming evidence that cash transfers reduce intimate partner violence, and there's evidence that they can also reduce sexual violence and sexual exploitation, particularly among adolescent girls in sub-Saharan Africa. And there's evidence from various regions that cash transfers can lead to reductions in the violent discipline of children. Some questions that still remain are how do intersectoral linkages boost these positive impacts? And what is the role of implementation of these linkages? So for example, what is the importance and how can they further boost impacts by working with key cadres such as social workers in realizing these impacts? And more evidence is needed around the cost effectiveness of cash transfers in reducing violence against children and intimate partner violence, and a comparison of their cost effectiveness versus other more violence focused interventions, which may be more labor and resource intensive to implement. Next slide, please. And next. Thank you very much.
Great, thank you so much, Shalini and Tia for those presentations, and Mark for your introduction. So, and I want to, I'm grateful to all of you who've been adding your questions in the chat. And what I would like to do now is I've been collecting all of the questions and organizing them thematically, and I'm going to invite Shalini and Tia to answer a few of them. And I'm going to start with a few that have been posted earlier, but if you have additional questions, please feel free to add them into the chat. We will continue to collect those. So Shalini and Tia, the first set of questions, there were quite a number of questions about sustainability, particularly after cash transfers end. I know you noted some results related to that, but I was wondering if you could talk a little bit more about that and specifically, you know, the kind of source of funding, sustainability following the end of cash transfer programs, whether we can expect to see violence reductions to be sustained, or what are some of the long-term effects. So let me turn it over to you for that.
Should I go first and then Tia, please add? So I would say in the first instance, that's a great question. It's obviously something that we are all interested in understanding better. Right now, we literally just don't have that many studies that are able to look at sustainability. We often have, in part because the evidence thus far has been on programs that were not focused on violence. The studies were really designed at looking at what happens to, their core objectives during the program. So looking at impacts on poverty, food security, human capital, and so on. And so it's often just been hard to get funding to kind of go back and look at sustainability of impacts after the program on any outcome, and particularly for violence. So the first point here is that truly we just don't have that much evidence right now on post-program impacts. I would say what we do understand is that in order to have post-program impacts, we're going to have some post-program effects on what's underlying the changes in violence. So I think conceptually, we could think that if we are able to, and this is where we think the plus programming, the complementary programming might come into play, if we think that we can bring in complementary programming that is able to have the effects on the pathways sustained beyond the transfers themselves, that might be one of the best strategies to sustaining impact beyond the end of the program on violence. So in Bangladesh, that we think occurred through effects on sustaining women's empowerment through kind of social capital, but there may be other strategies that are able to do that in other contexts. So I'll turn it over to Tia.
Yeah, I think Shalini gave a great summary. And the only thing I'll add is that indeed it is really hard to have the resources to follow up long-term in a lot of these studies. We have done that in Tanzania this year, so we should have results towards the end of this year, early next year, about that Cash Plus program in Tanzania that I talked about, where we're looking at impacts a year and a half after the program ended.
Great, thank you. We got a couple of questions about, I guess I'm thinking of it as dosage, right? The questions around how much, is there any research on what is the amount of cash transfer that may be a sufficient dose to see a difference? Has anyone looked at that either on IPV or violence against children? Or how much money specifically? Do we have any idea of what that threshold might be?
Tia, do you want to go first on this one?
Sure. So there isn't really a threshold that we could recommend for how much cash is needed to reduce violence against women or children. However, what we do know from other studies is that if the cash is a very low percentage of the pre-program monthly expenditures of a household, it tends to have fewer broader impacts. So for example, a cash transfer, which is maybe only 5 or 10% of what a household spends every month, is probably going to improve food security, but not much else. When we see programs that start to have around 20% of pre-program expenditures, like the cash is equal to about 1/5 of what the household spends every month, we tend to see much broader impacts on a range of well-being indicators such as mental health and things like that. And so we would expect similar need to have a higher proportion to realize effects around violence, but there haven't really been studies which have been able to test that so far.
I would echo that. I would say that it's challenging in the context of like a randomized study to have, lots of different levels of transfers that you provide to really try to identify exactly what level, you stop seeing effects at. But what we understand, as Tia said, is that, the transfer has to be quote unquote big enough to have transformational effects. And when you go back to thinking about pathways, for example, on intimate partner violence, in order to see effects coming through the economic security pathway, it has to be large enough that it's going to meaningfully affect economic security and thus meaningfully affect emotional well-being for that pathway to play out. There is kind of increasing work being done to try to figure out some more of these operational details. But I think for now, what we rely on is, as Tia says, kind of this rule of thumb that about 20% of household income in the absence of the program, that's a good benchmark for a transfer size.
Okay. Now, Shalini, this question, there's a batch of questions for you about the Bangladesh project around, how the training for women was conceptualized, and then whether there's been any research on the impact of the training itself without the cash transfer component, or any kind of unpacking studies, and whether there's any, what your sense is of how much, to what extent the impact on violence against women was attributable to the empowerment component or the gender component versus the cash transfers, or whether there's any sense of the combined effects.
Yep, those are great questions. So speaking very technically, we're not able to disentangle the effect of the cash and the training because they were only provided together. And this was a program that was really focused on food security, household food security, and child nutrition. it was trying to understand what form of social safety net worked best. So, it was really focused on, okay, we're providing the transfers. What else do we need to provide alongside them to better improve food security and nutrition? And then we also looked at violence. So basically, the evidence that we have can't kind of rigorously split out the two effects. But in terms of trying to understand the pathways and what we learn qualitatively, the sense we have is that the cash played some important roles. So first of all, because, women it was a soft conditionality to attend these trainings. So nobody was going to actually not receive their cash if they didn't go to the trainings, but they were kind of encouraged to go. And this probably vastly increased attendance at the trainings relative to what would have happened if they were, kind of not linked to the cash, especially because they were every week for 2 years. We also think that when we look at where we see impacts along the pathways, it looks like the women's empowerment pathways, we see effects on things like psychological well-being, kind of like measures of confidence, agency, and so on. But we also see that women just have more control over resources. Women's livelihoods are changing. And so it seems like the fact that they were able to have more control over actual resources does seem to matter. And the effects we see on stress, which seem to play out for, within the mechanisms for both the effects we see on violence against women and for violence against children, are likely to be linked, at least in some part, to the fact that they're getting the cash transfers and not just to the fact that women have more social interaction. So I think the short answer is we can't rigorously say, but our best evidence is that both mattered.
Great. Thank you so much. Another interesting question is related to income inequality within a country. So when you have variations in income inequality in a country, do those have influence on the impact of cash transfers on violence against women or violence against children? And if so, is there some thinking around how to what extent is it possible to have fundamental change to economic structure, or the kind of these structural drivers of those of that economic inequality?
Do you want to go first on that one, Tia?
Sure. So because most of the programs that we have examined in these individual studies and the reviews are anti-poverty targeted programs, they tend to target the poorest households in a population or in a country. So oftentimes when we look at the impacts, we really don't have an understanding of how it impacts across the distribution of income. We're looking at the impacts of very poor and vulnerable households. So we don't have a lot to say on that, but there are other contexts where this might be more easily investigated. So earlier in the webinar, someone was asking about high income countries. Here in the United States, the government has recently just expanded the child tax credit, and this is expected to have a very large impact on reducing child poverty in the United States, where here in our country, 1 in 7 children live in poverty. And this program is going to affect both low income and middle income households. So there is potential for these types of economic strengthening to reduce violence against children across the income distribution. But I would just say that the majority of the evidence that we have so far is really coming from lower income and poor households.
I completely agree. I would maybe just add that it, again, like kind of going back to the pathways, there are some pathways that might kind of be stronger for poorer households. Again, the economic insecurity, households that are economically insecure might have more of a change in emotional well-being from a cash transfer. But on the other hand, there might be some, other effects. So for example, if a cash transfer to a slightly better off household tends to lead to some kind of livelihood change that would lead to more sustainable impacts on economic security, maybe that's an offsetting effect. So yeah, as Tia said, we don't have the evidence yet. It's not completely obvious which way things would go.
And just to add to that, some of these newer cash plus or integrated social protection programs are trying to link marginalized families from poor households to other services. So these could be services around social services, health services. So there is a component of reducing that marginalization. So that might be another pathway through which this is working in addition to the economic strengthening.
Okay, right. All right, so another set of questions is around the impact of COVID-19 pandemic and what, and the related restrictions that have been put in place in many countries and the economic impact of a lot of those restrictions or of people's individual behavior and avoiding places like restaurants and retail places. Has there been any research on either how the past year has impacted either the implementation of cash transfer programs or the outcomes of cash transfer programs, or both? Any thoughts on that?
Do you want to go first on that one, Tia?
Sure. So there is overwhelming evidence that COVID-19 is leading to an increase in violence against women and children. When we think about children, a lot of times their linkage to services or support is through schools, and especially in middle and higher income countries. So as schools have closed and children are left without that resource, there are a lot of cases going unnoticed. And there is also evidence that the economic stress of the pandemic, so the different levels of social and economic stress around social distancing and job loss, these are leading to increased stress and increased violence being perpetrated against women and children. At the same time, over 180 countries and territories have actually expanded or introduced new social protection programs in response to the economic crisis that's caused by COVID-19. So there's good news and bad news here. The bad news is we know violence is increasing. The good news is that we know that most governments have actually expanded programs which we think might help mitigate against violence. So is it enough to have offset the violence risk during this pandemic? Probably not. But I think one of the really interesting questions that we need to track in the future is how many of these programs are actually going to be sustained beyond the pandemic? So has this opened a new window for economic strengthening programs and social protection? Is there renewed interest in sustaining these and expanding these beyond the pandemic? And so that's the silver lining, because if these programs are expanded and sustained, then they could have a lot of potential in reducing violence against women and children.
Great, interesting, lots more to come. Shalini, do you have anything to add to that?
I guess just to say that in terms of how cash transfers have been implemented during the pandemic, there have been more kind of one-off cash transfers. Some places had piloted this before, but I think the type of cash transfer programs that are more regularly used in a lot of low and middle income countries are sort of these small, regular transfers. Whereas during the pandemic, I think there was in many places sort of like a large one-time transfer. There is some evidence from prior pilots, including in Kenya, showing that even those types of transfers can reduce violence, again, through some of these same pathways. And I think, like Tia says, this has sort of created an opening for a lot of places to consider whether these types of safety nets can be expanded beyond the pandemic. In terms of whether there's been kind of evidence of the measures that have been taken having impacts on violence, there's some studies. It's been hard to get really good studies designed because obviously people aren't trying to like randomize assistance during this pandemic. I think the evidence that's been out has been promising that these programs have helped. But yeah, I think part of the question is then what happens after the pandemic is kind of winding it down.
several of our attendees today are interested in understanding early marriage or child marriage. Have there been any studies that looked at impact of cash transfers or on early or child marriage, or kind of thinking about that context? So thoughts on that?
Yeah, so there was a recent review that came out that looked at the impacts of cash transfers on early marriage, and they did find protective effects where cash transfers were delaying child marriage in a few different contexts. But this is very context specific, and it doesn't necessarily happen everywhere. So for example, just to take Malawi, a smaller non-governmental cash transfer was found to reduce child marriage, but the government implemented program, which reached marginal households at a larger national scale, was not found to reduce child marriage. So what the evidence suggests is that more frequent cash transfer payments, which are made to reduce economic insecurity, so they improve economic well-being, these can help households invest in children and adolescents by allowing them to go to school, making them healthier, etc. And these are some pathways, particularly school attendance for adolescent girls, which can help reduce child marriage. There was some evidence from India, which suggested that a lump sum payment once a girl child turns 18 to prohibit child marriage was not as effective, because what in turn happened is that parents received a large cash transfer payment on the 18th birthday for not having married the girl off as a child, but in turn they ended up using that as dowry. So there's a suggestion that the context matters and the type of cash transfer program. So smaller, more frequent cash transfers, which help households invest in their children, help them go to school, because school is such an important pathway. There's some evidence around that. So there is evidence to suggest that cash transfers can reduce marriage, but it is very context specific.
Melanie, anything to add to that?
No, I think that was a great answer.
Now going back to this concept of multi-component interventions, and I think you both spoke to that a bit and gave some examples. Kind of, I guess I'm curious, thinking in the context of Inspire, and maybe Mark, you're welcome to join in here too. In Mark's introductory discussion related to how income and economic strengthening is just one strategy within Inspire, and there's connections to the social norms change, to safe environments, to parents and caregiver interventions. And you guys gave some examples of that, but kind of on the whole, do you have some ideas or thoughts about where those leverage points are best gained in terms of when you come, what is the smartest combination of cash transfers plus what, and on what types of outcomes, or does it matter whether we're talking about violence against women, violence against children, or both, or any other outcomes?
I guess the only thing I would want to add is more a question to you, because I think I heard a few things in your presentation that kind of challenged the way that we framed this. And I think what I was hearing was that these cash transfers will actually reduce violence against children, whether or not there are these additional components, whereas we are certainly have been promoting cash plus parenting and life skills. And I think what I heard from you is there actually is a base of violence reduction that will happen whether or not you have these additional components integrated. So I think to Greta's point, what's really interesting for us to consider as various countries look at how they layer interventions, to what extent should they be layering education, life skills, gender norms, and other interventions into cash programming? And your thoughts on that would be most appreciated. Thanks.
These are really excellent questions. And I think the way you both framed it is right on. So I think it's right that the evidence so far is suggesting that cash on its own does, it can reduce violence even without, programming specifically targeted at violence. That said, I think we believe that it's a great opportunity to to kind of build in other programming with it that can strengthen these impacts, and that there may be some synergies. So for example, in the Bangladesh case study, it seemed like the cash alone would not have done it, the training alone would not have done it, but the cash and training working together had this kind of synergistic effect that, gave, in that example, women both the empowerment and the, kind of both the social access and the resources to kind of increase their empowerment. So I think in terms of the evidence, there's still relatively little on, really rigorously comparing cash only versus cash plus different things. And again, this relies in part on where we're able to get funding to actually look at these things. And often they're not programs that are interested in, or, that are focused on violence. And so it's kind of hard to add on these components that we think could actually be quite powerful for kind of these synergistic effects. I think the type of things, there's kind of two categories of types of things that you could think about as plus. It's sort of plus components for stakeholders who aren't necessarily interested in violence that could build on whatever their objectives are, but like kind of tweaking the platform, tweaking the design. So even within a basic cash transfer program, like the standard, tweaking the messaging, tweaking the transfer recipient, tweaking the framing of, how the transfer should be used. If you are going to have a focus on nutrition, making the platform one where women can gather, things like that. And then there's a category of, if you were trying to be gender transformative or, violence sensitive, things you could add that might be, more specific components focused on violence. And that is where I feel that at least in the IPV work, there hasn't been yet much of that, because there just hasn't been the kind of funding for it. But we're increasingly trying to push in that direction and start to experiment more with components that might be more gender transformative in the case of IPV. And maybe Tia can speak more to that and violence against children.
Yeah, so that's the million-dollar question, is what combination do we need to reduce violence against children? And the answer is, we don't know. So probably not the answer you were looking for. But I would say that what we need to start looking more towards is not, what specific intervention do I need in this specific program layered onto a cash transfer, but more thinking about integrating systems for longer sustainability. So how do you link these anti-poverty programs and systems to child protection systems within a country? So a lot of the integrated social protection and cash plus programming is really trying to look at the multi-dimensional vulnerabilities that these poor households are experiencing, and how do you address across different sectors multidimensional poverty and vulnerability. So once you identify poor households that are in need of economic strengthening, how do you link them to health insurance and health services, child protection systems? So as Shalini mentioned, there just really aren't a lot of studies that have been able to unpack this layering and say, which combination is more effective than another, or is this combination more effective than just cash alone for reductions in violence against children? But there are some really promising pilots that are around integration of government systems. So for example, in Mozambique, they've been trying to link a child grant program, so cash transfer programs to pregnant women, to child protection systems in that country. Also in Ethiopia, the very large cash transfer program, the Productive Safety Net program, reaches millions of households around the country, and they have new efforts with integrated pilots within that government program to link households to child protection systems through social workers in country. So I think that's where we need to be looking, is how do you integrate these systems and target multidimensional poverty. But right now, it's really hard for us to say which combination is the best.
Yeah, that's
Oh, and I would just say, sorry, I would just say that in addition, some of these plus components that you mentioned, such as gender norms training, some of these things I think we need to be following longer term. So there has been some evidence now emerging from Latin America where the cash transfer program started even earlier of how did living as a young child in a cash transfer household, how is that affecting young adult outcomes? So we don't have any evidence on violence, but because of these reductions in some of these pathways, such as witnessing intimate partner violence, there could be intergenerational effects. And it would be really interesting to understand that. In addition, some of these cash plus programs, which combine cash or savings with gender norms training, this could be very effective in early adolescence if delivered both to boys and girls, because if it has effects on their attitudes around gender equity and violence perpetration, if you're getting adolescents early before they start to form their romantic relationships, these combinations of programming could have effects longer term. And in fact, that's what we saw in Tanzania, is that among boys, that cash transfer program, the Cash Plus program, actually increased boys' gender equitable attitudes. And those are the same violence perpetration. So there are intergenerational questions that I think still need to be answered.
Thank you. Yes, I think that the kind of, to what extent are there unmeasured impacts of these interventions is a really interesting question, and one that I think we need to continue to explore as well. So I think one more question that I think would be useful to discuss or to hear your thoughts on is this idea of kind of how to best think about who should be reached with these interventions, and in terms of are these best framed as universal types of interventions that are delivered to anyone who meets certain eligibility criteria, fairly broadly defined, anyone who lives in a region or a community, or are these or framing cash transfers programs best for targeted interventions to reach risk populations, or both? You know, kind of are there thoughts on that, or research on framing those?
Do you want to take that, Shalini?
Sure. So I think the question of targeting cash transfers is a really interesting one. I think there's a lot of considerations that come into that. One of them is just, political economy, and kind of just working out the allocation of public resources. Obviously, if you target it, or if you provide cash transfers universally, that takes more resources than if you target it. There might be more buy-in for cash transfers if they're provided universally than targeted, but there might be different impacts on different groups. So there's just a whole mix of different considerations. I think going back to the question asked earlier, what we know the most about right now is the impacts on those who do tend to receive the cash transfer programs and the studies that we look at, which is typically the poor, for the reasons that Tia described. These are, typically framed as anti-poverty programs. And so I think it's hard to say what effects you'd see on a less poor population. Again, speaking to some of the pathways, some of them seem like they would be most operative for poorer households, or households that are kind of initially in the worst situation with respect to some of those pathways. On the other hand, there might be other pathways that kind of play out more with, households that are less poor. So I think the short answer is, again, we don't exactly know, or I don't exactly know, but I think in practice, the targeting of cash transfers is necessarily going to involve more considerations than just, where violence prevention might be most effective. I don't know if Tia has more to add.
No, I think you summed it up nicely.
Great. Thank you so much. So I think we are very close to reaching the top of the hour. So I want to thank Shalini and Tia and Mark for your presentations, and for sharing your expertise. And to all of you who attended today, thank you for joining, for your excellent questions. We have put in the chat the link to the WHO website where the recording for this webinar will be posted along with the slides, as well as the recordings for previous webinars. So we invite you to go to that website and take a look at any of the videos from the previous webinars if you have not been able to join those. As a reminder, we do have 2 more in the month of April, focusing on response services and education. So we're excited to talk about those strategies coming up. And thank you all. Have a great day.
Thank you. Bye.
Bye.
Thank you so much. Thank you for all the great questions.